Hello and welcome to the WIHS Journal, Public Affairs from 104.9 FM. I'm Paul Kretschmer. The subject of today's broadcast is the coronavirus known as COVID-19, which has been moving around the world at a rapid rate and has required response from state governments all over the country, including in Massachusetts, New York, and here in Connecticut. On today's WIHS Journal broadcast, courtesy of CTN, excerpts from a news conference held recently at Bristol Hospital, featuring Governor Ned Lamont and officials from Bristol Hospital talking about the prevention and the treatment and the control of COVID-19 here in the state.
We are working together at the federal level, at the state level. Josh is helping to take the lead, along with Renee Coleman-Mitchell, our head of Commissioner of Public Health, working with the professionals here at the hospitals, as well as our local health community. And we're trying to make this seamless and give a coordinated message in terms of what our priorities are. And Kurt, you reminded me, and the mayor reminded me on the way here that next year is the 100th anniversary of Bristol Hospital. And Roger Newell gave the land, I think, 100 years ago for this hospital. And he gave the land because he was inspired, a little scared by what had happened that a couple years earlier with what they called the Spanish flu. And our local hospital system back then in 1918 was overwhelmed. And even the Congregational Church here, the parish hall, was loaded with patients. And that was the inspiration behind Bristol Hospital close to 100 years ago. And I just think you should know that today, 100 years later, Connecticut has one of the best hospital systems in the world. Nobody can be totally prepared for a virus like COVID-19, a virus that's changing every day, and the infections are accelerating every day. But we are working together on a collaborative basis to do everything we can. I'll tell you that, working with Josh, we have notified all of our state employees right now, no travel out of state, not necessary. Anybody thinking about coming into state, contractors or otherwise, try and do that by teleconference. Try and do that by telephone. Let's limit what our exposure is. Marco Jakian, overseeing our universities, same message to those students. No need to go home over spring vacation. And if you do go home over spring vacation, you may ask you to self-quarantine, self-monitor for 14 days on your way back. An ounce of prevention. I think we're trying to get ahead of this. We've looked what happened in Seattle. We see the accelerating infections in just in Westchester County, right nearby, southern Connecticut. And infections know no state boundaries. We're being very careful in terms of our state employees as well. Look, you don't need big meetings with 100, 200 people. I know we got a bit of a crowd here. Please sit one seat away from each other. But this is important. And we're telling sort of our older state employees, bring your laptops, stay at home maybe as needed for the foreseeable future. Those of you who may be older or maybe have some respiratory issues or other things that could put you at risk. And this is a message that we're taking to private employers around the state as well, trying to lead by example and make sure we coordinate. Over the last week, as you know, we've not only met with all of the hospitals. We have phone call today again with superintendents of schools, following up with all the mayors, met with the legislative leadership or talked to the legislative leadership just yesterday in terms of a coordinated response, what they should be thinking about in terms of the legislature and big public meetings. And we'll be following up on that as well. Kurt mentioned the testing and the fact that we do have another test kit. That represents the ability to do another 600 tests. We've done less than 50. All that means to say is we are prepared. We've obviously had our first Connecticut case of COVID-19, and it will not be the last. Kurt was telling me about the trailers that have been on order here. So over the next week or so, let's hope that they'll be able to do some preliminary testing right here at the hospital. People, only come if you have a physician's order. Only come if your doctor says this is something you probably ought to check out. Then you go into that first trailer, they'll check out, see whether you ought to have that test. We have that test. Take it up to the state lab and make sure you'll know within 24 hours what your status is. I'll just leave you with the fact that I've said everywhere I go, hope for the best and plan for the worst. And that's what we're doing. I think from a collaboration point of view, I'm talking to my fellow governors. We had the Surgeon General, federal government, come and make sure that what we do is give people a consistent message. Be careful, use obvious prudence, and we're going to get through this in the near term, staying together as a state. Thank you, everybody. Senator Blumenthal.
Thank you. Let me first thank Governor Lamont for his very calm, vigilant, and vigorous action in response to this crisis. He has demonstrated the courage to face facts and reality and talk about it clearly and candidly. I wish the same could be said of our president. Deception and denial are not a strategy. What we've seen at the federal level is too much lowballing and bungling. I am glad that finally we have another diagnostic test here in Connecticut that will permit expanding the amount of testing. It is too little and very late, inexcusably late. These kits were promised last week to me personally and other senators by the Vice President, still unprovided, even though they were promised. And this one kit is simply the beginning of what needs to be done for testing. To put it very simply, we cannot know the rate or the root of infection without prompt and thorough testing. You can't know without testing. You can't combat this disease if you don't know its extent. I want to thank the hospitals for their professional excellence. We ought to be very proud of our hospitals here in Connecticut. They've stepped up. They've said cost is not a consideration, but they should be reimbursed for all of these costs because we know the hospitals are hard-pressed as it is. I want to thank the docs and the staffs and volunteers and board members of this hospital and all around the state of Connecticut and local health directors and officials who are here today. Thank you, Mayor, for your excellent work at a local level. And we ought to be very proud of our mayors around the state because they've stepped up too. The resources now are there at the federal level, $8.3 billion, championed on a bipartisan basis. The votes were overwhelming, only one vote against in the Senate. Unprecedented in recent history for a major measure. So reimbursement for Bristol Hospital will be forthcoming from the federal government, reimbursement to local and state health directors and their departments, as well as aid for the development of a vaccine, new therapeutics, new diagnostics, and the CDC and NIH. We need to avoid cutting their budgets as the Trump administration has proposed. And let me just conclude on this note. We are facing a threatened economic whirlwind. We need to aid businesses, especially small businesses, as they face possible sick leave on the part of their employees. And no question, employees who are sick should avoid coming to work. Among the precautions suggested by the governor, all of them excellent. Let me add this one. If you're sick, stay away from work. If you're an employer with a sick worker, encourage them to stay away from work. All they can do is infect others and cause even more workers to be ill. And the federal government must provide assistance for sick leave. It should be paid sick leave, but small businesses should not be asked to shoulder the burden without aid from the federal government. That's our next challenge. There's already in the $8.3 billion supplemental, $1 billion in small business loan subsidies to help them weather this storm. But we are truly facing an economic whirlwind without White House leadership capable and credible and experienced in the way that's necessary. So I will be returning to Washington in just a couple of hours. I'll be urging that the president enlist a new economic team with battle-tested and crisis-respected members who can help direct what the economic response should be. And probably we'll need a federal stimulus plan, including aid to small businesses and bigger employers as well. But I've talked to now hospitals. We've been all around the state. We were in Bridgeport on Saturday. I've been in Hartford, Milford, New London. The common theme is we need the resources. Small businesses are going to be hard-pressed. They need to be helped as well. Thank you. And I'm to be followed by Dr. Andrew Lim, Director of Emergency Medicine at Bristol Health. Thank you, Dr. Lim.
Thank you, Senator. Good morning. I wanted to give a brief update about our efforts locally here at Bristol Hospital. We have been meeting on a daily basis for the last few weeks, really coming up with plans with the overarching goal of, A, how do we care for our patients safely? How do we protect our staff? How do we protect our patients? And how do we create an environment knowing that there can be a potential surge in patients where we can continue to care for those patients? We are working on and have come up with many protocols about how to safely screen for patients as they present to the ER, because really the quick identification of those who may become a person under investigation is really critical in terms of determining who may have coronavirus and making sure that they don't expose others. We've been working with staff in terms of making sure that they know how to appropriately use their PPE or their personal protective equipment so they can care for a patient in a safe manner. We're also working on kind of some unique emergency department protocols where we can separate out those who may have the illness and separate them out from the general population in terms of working on obtaining more negative pressure rooms and setting those up, but also some unique things in terms of a front-end triage process. We've actually ordered multiple mobile units with the idea that a primary care physician can perform a phone screening and identify those who would be appropriate for testing. A patient can come to the hospital to have those swabs performed without entering the building, and they can leave as well, similar to many of the outpatient tests that we currently perform. In a similar fashion, the front-end process allows a clinician to identify who may need to be tested, and those patients can be tested in that kind of separate environment. But with the added utility of utilizing technology such as telemedicine to allow that patient to be evaluated by a physician or a physician's assistant without unnecessarily exposing them to risk. So in summary, I just wanted to give you an idea of all the efforts that are occurring behind the scenes at the hospital on a regular basis. We're working with many of the older local hospitals and really taking our guidance from the CDC, from the World Health Organization, from our infectious disease specialists, and really bringing together the directors of every department to make sure that everyone is safe during this time. Thank you.
And that concludes this news briefing of excerpts from a news conference held on COVID-19 featuring Governor Ned Lamont and officials from Bristol Hospital recently. The broadcast was made possible by CTN, which provided this material for us to share with you here on the WIHS Journal. For further information, call us at 860-346-1049. The opinions expressed are those of the participants, not necessarily those of the staff or management of the station. I'm Paul Kretschmer on the WIHS Journal, Public Affairs from WIHS, Middletown.